What's going on, you guys? Dr. Nash here with Complete Connection Chiropractic. Today we're going to be going through an adjustment walkthrough here with Colin. Now I'm going to give you guys a little bit of context on our relationship. Colin and I have been working together for almost a year now, so it's been pretty sweet watching not just him go through his process, but also everything that's led up to Colin today. It's been a beautiful journey. Now Colin's background, he's a college athlete. And before that, he was playing a bunch of high school sports. So he's got things that have really kind of stemmed from old high school injuries into college. And when we first started working together, there were things that he's been dealing with for years and really stemmed around foot, ankle trauma that he had from a cliff jumping incident, which we'll save the details on that. It's been really cool seeing his progression and really making sure that when his foot mechanics are better, everything up the chain from his knees to his hips and literally everything up to the top of his head has improved too. So it's been really awesome, and we're going to kind of walk through the process with Colin today as well. Again, like I said, he had some history with foot trauma, so I'm really always assessing, number one, how his feet are looking, but again, how things are moving up the chain up through his hips and how fluid are things. And especially when I'm assessing if he's got any extra tension, as I give a little bit of pressure between his right and left, that can give me a little bit of insight into his pelvis. And if he's got some rotation, counter rotation that's preventing him from getting proper motion up through his spine as well. As we go through this process, I'm getting a little bit more feedback on his left side. When he's got posterior tilt back on the left, that's really gonna express a lack of fluid motion and really gonna create a little bit more extra tension into his low back. So as we move up the left side, I'm really assessing his left side of his pelvis because I was getting that initial feedback down here at the feet. And as I dive in deeper, I'm just giving his hips here a little bit of play and seeing not only is there restriction, but in what direction? Because he's also got a sacrum in between his hips, which is a really important piece to not just function of how well he's moving, but just overall brain to body communication to his internal organs too. So actually pretty important. Now, as we assess a little bit deeper with the muscles, picking up on some tighter, more present muscles on the left side. So they're doing a little more work than the right side. So again, when I'm seeing a hip that's rocked back this way, a lot of the time, these muscles are gonna be doing a little bit more work on this side as well. Colin does a lot of windshield time. So he's in the car a decent amount and getting up in and out of the car. So one of the things that is going on is he's sitting a lot. And when that happens, especially him being a bigger guy, his compression from sitting can really pull up and create a restriction with extension here in his mid-back. So what we're gonna do today is we're actually going to introduce a force, take pressure off this area right between his shoulder blades. So as I feed in, number one, I'm getting good feedback from his system and really making sure that I'm right on point with where I want to be adjusting. Beautiful. Really, really clean, really precise, right at T7. So as we work down, we're gonna be focusing on this left side hip. So what we're gonna do is we're gonna have Colin lay on his right side with his left side up. Now, one thing we really are assessing, especially as we go through an exam with anybody, is really making sure we understand what's an appropriate way to adjust somebody, because Colin is different than anybody else I've seen in my practice because he's unique to himself. So we really need to make sure that the process of adjusting him is unique for him. And as we focus down here on this hip, I am introducing a force that's gonna bring his hip going from backwards to forwards. And a little bit of roll. Beautiful. Nice, awesome, brother. And we're gonna flip to the other side. Whenever we see somebody with posterior pelvic tilt on one side, a lot of the time we'll be assessing the opposite side because the body is always trying to compensate and straighten itself out because it always wants to keep your eyes level at the horizon. So Colin has had a little bit of counter rotation into his left side, right above his hip level with his lumbar spine, his low back. Now we're gonna use this arm to actually create a little bit more space, make him a little bit longer. And we're just making his spine nice and comfy. So then when we introduce force, it's so clean, super easy. Okay, awesome. Colin, go and lay on your back for us. Through a little bit of work together, we really discovered Colin's had some TMJ dysfunction. So part of the process with caring for him is making sure his jaw is moving a lot better because there's so many nerves that go to the face. And we clear that out and help his jaw move better. It really clears out the rest of his system, allows him to be a lot more at ease. An important piece in caring for anybody is he's a new person every time he comes in. So not only am I getting really good feedback and information on day one as we go through an exam, but as we continue to work together, we get to see his body continue to heal. Now, I'm not gonna be adjusting the same thing every time because his body is different every single time. We might have similar patterns, but today, we're really gonna be focusing in his lower neck. We're gonna be focusing right at the base of his skull, which is probably one of the most important places in the body. So we're gonna start right over here on the left. As we finish up and through, Very clean, very smooth. Okay. And at the opposite side. Awesome. Okay. Very clean, smooth, comfortable movements, because whenever we're adjusting, especially the neck, the goal is to make sure that his spine and his spinal cord, there's no tension. We never adjust from a point of tension. We're always adjusting from points of ease, so it's comfortable for him and allows for a beautiful release, allowing his body to relax. Okay. So next, we're actually going to take a look at his jaw. Now, the jaw operates on hinges, and the tendency is for most TMJ disorders is they shift out of their hinge. And what we'll do is we'll have Colin open wide and slow. Awesome. Close. Okay, fantastic. Let's do one more. Good, and close. Okay, good. So I'm going to help guide his jaw and really give it more of just a little bit of traction and ease back into the right place. So it's gonna be really simple. We're just gonna have Colin do that same thing, wide and then close. Good, really, really easy. The same over here. Good, very good, awesome. Last but not least, we're gonna take care of Colin's feet. And one of the biggest things we're gonna be doing is working on decompressing his heels. Because one of the first things he came in for is really trying to figure out more answers on why he has chronic foot pain. You had heel and foot pain for what, 6 years?
6, 8 years.
Six, 8 years?
A long time.
And we went through a game plan, we finished that up, and after 4 months of working together, you had no pain for the first time in 6 to 8 years.
Life-changing.
So, really, really cool stuff. So now, the tendency for heels that get really jammed up is they also have a tendency to invert. So not only am I going to work on decompressing his heels, but also going to help on them from staying turned in, kind of like a typical sprained ankle. So as we work down here, I'm going to be working on decompressing and then finishing back out across. Good. Very nice. And the forefoot here, we're going to work on making sure that he's able to point and flex his toes. So for this, we'll be right on top. Be right on top. Nice. Very clean. Good. Awesome. Okay. And this is the row of his arch. So again, whenever somebody lands here, his arch lots of time is going to get pushed out this way, and it's really going to affect his foot's ability to use his arches to dissipate force throughout his foot. So we're going to help those sit just a little bit cleaner. Good. Just like that. Awesome. Going to repeat the process on his right foot. Good. Just like that. One of the awesome parts about us working together is this is not just a one-time event. From the game plan from day one, we also had things that Colin was be working on at home too. Because it's a lot like brushing your teeth. You're not just doing it on days they feel fuzzy. It's something you do consistently every day. So part of the routine with Colin was making sure that he had consistent, intentional things that he could be working on every single day that's maintaining progress in between visits. And one of the most important things for him is getting his mid-back opened up, because again, he's sitting and driving a lot, and really making sure that we're paying attention to the middle part and lower part of his back. So what we've been having him do is something we call landmine stretch. And we'll walk through those right now. So when we're working on landmine stretches, this is really helpful for anybody in any line of work, because it's something you can do in the office. It's something you can do on the road. It's something you can do in an airplane. You can do it anywhere. And what we're using is the concept that we're using lateral bend, kind of like an accordion, where we can start spreading and flaring part of the ribs that attach the spine, and using the breath to kind of work like an accordion, so we can actually create some natural decompression. A good starting position is being about a foot distance away from the wall, and you're going to square yourself up, and whatever the inside leg is, you're going to take decent size step backwards. Inside arm closest to the wall is going to be going up the wall, and that inside hip is leaning into the wall. Now the final little piece that'll make a difference is if with the opposite arm, you're just subtly engaging your elbow into your side. Now what my instructions are for most people are to take 10 deep breaths in this position, and why this opposite arm is important is because we're also subtly engaging the opposite side muscles into that side body. And when we're in this position and we're adding in breath, not only is the wide side getting some decompression, but so is the compressed side. So by adding in both of these, it's creating a really nice nuance for the spine, nice and oiled up so people can move better, feel better. If any of this resonates with you, running an awesome special right now for $47 that covers your exam, your adjustment, and going through in a detailed assessment, understanding how this can fit into your day-to-day life to really make sure that we're getting to the root cause, getting you not just symptom relief, but an actual solution. For $47, you can find a solution to what you've got going on. Click the link below and let's get connected.